Hi, I'm Whitney Perez, and today I'd like to discuss the health belief model and social cognitive theory. But first, I would like to discuss what a theory is and why they're important. So a theory is defined as a set of interrelated concepts, definitions, and propositions that explains or predicts events or situations by specifying relations among variables. A theory can present a systematic way of understanding events, behaviors, and situations. Some of the most successful public health interventions have a theoretical foundation, and evidence suggests that interventions developed with a theoretical foundation are more effective than those lacking one. The health belief model is one of the most widely used tools in public health. It was developed to help understand why people did or did not use public health prevention services in the 1950s, and has evolved since then to address newer concerns. The health belief model suggests that people's beliefs about whether or not they are at risk for a disease or health problem and their perceptions of the benefits of taking action to avoid it influence their readiness to take action. The health belief model suggests that an individual's course of action often depends on a person's perceived susceptibility, their perceived severity of an illness, and their perceptions of the benefits and barriers to related health behavior. Now to talk about the social cognitive theory. This is another very popular public health theory. This theory was developed in 1986, and it considers the unique way in which individuals acquire and maintain behavior, while also considering the social environment in which individuals perform the behavior. This diagram here visualizes how the social cognitive theory explains human behavior in terms of a three-way dynamic reciprocal model in which personal factors, environmental influences, and behavior continually interact. The social cognitive theory theorizes that people learn not only through experiences, but also by observing actions of the others and the results of those actions. The core constructs of this theory in order to achieve behavioral change are reciprocal determinism, behavioral capability, observational learning, reinforcements, expectations, and self-efficacy.